we need to work fast. So for this mission, I'll need rubble. I'll need you to use your magnet to lift the helmet off Bettina's head. Rubble, I make double. Chase, I'll need you to use
moved around the GTA, maybe farther afield. Why is that?
Pass it over to the Minister of Health.
Well, we have made considerable increases into the number of beds available, knowing that with COVID-19 there would be a large number of hospitalizations. So we've increased the number of beds by 3,100 since last year. We also, even with the budget, put in another $125 million to create another 500 spots. We have been increasing capacity at every hospital that we can, creating as many beds as we can. We also are ready to stand up a mobile hospital at Sunnybrook and are ready to start one in Hamilton as well. But notwithstanding all of these accommodations and the significant capacity that we've built in, the hospitalizations that are happening as a result of these variants are taking over our hospitals. That's why we're having to cancel most surgeries and procedures, many of which have been delayed for a long period of time, and why many patients are having to be transferred from one hospital to another across the province. This is not just a GTA issue. We know that even in Kenora, if they have someone that needs to go to another hospital, they only have 4 intensive care beds. They cannot send anybody to Thunder Bay or to Winnipeg. So this is a situation that is happening across the entire province, and that's why we needed this stay-at-home order in order to be able to get these numbers under control so that we can care for the people who are coming into hospital with COVID, but also people who may be involved in a significant car accident or people who have heart attacks. We need to make sure that we have capacity to care for people that need intensive care, stabilization and care.
Next question.
Your next question comes from Travis Danraj with Global News. Please go ahead.
Hi there.
Hi, Travis.
For Dr. Williams and for everyone. Dr. Williams, last week my colleague John Michael McGrath from TVO asked you point blank if the state of COVID in Ontario amounted to a failure in public policy. You disputed that assertion. My question to you now, amid the backdrop of record ICU numbers, schools closed in the largest city in the province, and rapid variant spread is, do you stand by that assessment? For the Premier, the Minister of Health, and the Solicitor General, do you agree with Dr. Williams that the response from this government has been appropriate and timely, considering the dire circumstances we are all in, and the fact that a third state of emergency is now in place a year after all of this began?
So when you asked the question last week, we said we moved into the so-called shutdown. We took steps to take that into position. As I said, the numbers of cases, and we're not the only jurisdiction. Our fellow provinces to the west are facing the same types of issues as we all seek to try and bring this under control. And so I think the policy decisions are timely and at a good pace. We'd always like to be ahead even further if we could see it happening. I think they have to be taken in stride because there's parts of the province that are not affected yet. But as the Minister of Health said, some parts throughout different areas are being impacted at different times in different way. That's how the variants of concern